And in the meantime, I will just hand back to Rola to discuss some of the questions and comments that came in during the presentation. Geraldine O'Neill, you had a question relating to whether context impacts on misalignment. I don't know whether you want to add something to that question for Rola.
Hi Rola, how you doing? It's Geraldine here. I hope I'm not hogging the floor with all the questions, but I'm really interested in your talk. I suppose what I was particularly interested about is, like Nora was talking earlier about contexts and different contexts, like there's internships and clinicals and these different types of one. And I did wonder, was there more of a misalignment for the students who were in the type of context that are assessed more by educators than those that have more assessed by employers, practitioners, whatever you want to call them? So is the context, is that misalignment more severe in some contexts?
Yeah, thanks, Geraldine. Yes, so we saw more misalignments in the loosely coupled placements than in the tightly coupled placements. So if you think about nursing or education or teaching, for example, those sorts of highly regulated, what Anne-Marie talked about, where you've got national competency frameworks, those things act as coordination, there's accrediting bodies, and there's a strong vocational view. So the idea that the student can see what they're doing in the placement, really contributing towards who they are becoming. And often these assessments tend to be work-based and heavily supervisor driven. And so these actually were better aligned for the most part than the loosely coupled contexts that were often reliant on, say, a report, a learning contract at the beginning and then a report at the end. But because there was so much allowance for variability in the placement, the report often was, the feeling was it was really more of a tick box exercise about, reflecting. And I was actually speaking with someone in our breakout room. Reflective assessments are good for what they are, in terms of they show that someone can reflect, at least according to a model in a written format. What they don't show is that they can do the thing. It shows that they can talk about the thing, and that's not the same thing. So how do we capture the performance as well as the reflection of the performance? So the short answer is yes, it does. There are differences in context.
Thank you. Thanks for that. Thank you.
Thank you. Somebody else, F. Murphy. I don't know who F. Murphy is, but F. Murphy asked whether Young's personas agreed in advance by the three partners would provide exemplars of the behaviours and skills that will be assessed. Would that be a means of being able to do that?
It's not how I'm using the term persona. I'm using the term persona. It comes from persona studies, which is from celebrity studies. Actually, I recently gave a talk about what we can learn from Kim Kardashian. And that's because the way I'm talking about persona is these are strategically constructed by the student. They're strategically constructing their persona to a particular audience. And it's kind of a bit like identity, but it's more fluid and emergent and constantly being constructed. And why did I bring that up is because something to be authentic, it needs to bring the whole person in, and it has to tie in with their goals and how they are developing. And assessment needs to offer an opportunity to do that, I suppose. So I don't actually know, John, I'm a physio, I'm not a psychologist, but I wouldn't see the way I use persona as particularly related to behaviors in any archetypal way.
Sorry, that was my question, Naomi Finbar Murphy. I was doing it in the context of when Rola was talking about how they portray themselves, and that might be they portray themselves at the beginning of the process and at the end of it. But if they were told at the beginning, by co-constructing with the university, the industry representation and themselves, they'd be able to they'd navigate their way to that end outcome. That's where I was thinking. So when you put the personas of the entrepreneur, the caregiver, within different contexts, they may prove quite useful. I've seen them in the past in social contexts, but I suppose in business contexts, they could be used as well. They're the only two contexts I've ever seen them. I never thought about Kim Kardashian actually when I was typing about it. Shut up.
Yeah. So I think there's something. If I could rephrase that just a little bit, perhaps it is about helping students to have a go and try it on, really, about what it might look like to be someone in that industry who's employed and having a go, whether it's in an entrepreneurial way or whether it's in a business way or in a nursing way. We learn to become, and because assessment has such an important influence on learning, seems wasted to me that it's spent ticking boxes, really, just to ensure that we feel comfortable in the university, that it is consistent and reliable. I think there might be some other things that matter, not all the time, but maybe when we think about programmatic assessment and getting lots of data points on students across a program of work, that some of them do need to be really high stakes and some of them need to be more about showcasing what the student can do and what makes them distinctive.
Thanks, Rola, and I think that fits very well with what you outlined at the start of your presentation about assessment being a moral act, and about shaping the students for who they will become. Sue Hackett. Sue has a question here. Sue, I don't know whether you want to come in yourself there about whether Rola has experience of. I'm losing the chat. The chat is going up at such a racing pace. Experience of specific contexts that you may have seen workplace supervisors given an active and equal role in the development of meaningful assessment.
Oh, that's a really good question. Have I seen it myself? I can tell you what I know best, and that is in health. For example, when we developed the national assessment for physiotherapy, the Australian Physio, the APP, I think it's called, there's a really big consultation process that happened into talking about the competencies and what these look like, what matters to the profession. But beyond the words, there was a big consultation process around what does this look like. And so then there was moderation videos that workplace supervisors would engage with and would talk about, these videos that were created of pretend physio students doing various activities with patients, and then they would talk about what they would score them and why, and in those moderation activities you come to learn about the standards, and there's a better shared understanding of what this words on a page mean, and so the assessment task itself then became standardized in the sense that all universities across Australia had to adopt this particular tool. Look, it's not without its problems, even with all the investment that health puts into training their clinical supervisors. It still, there are probably consistency issues, but I'd say it's better, and that actually there are some really good things around feedback that have been built into that process. And because you trained and assessed in it as a student, when you become a supervisor or even just a physio in the end, you kind of have internalized some of it and you know the language of it. But to be honest, because I'm a full-time researcher now, I don't get to see a lot of the practice, but it would be really interesting to know if there is anyone here who does do that really close collaborative work between industry and university.
Thanks, Rola. And I suppose there's so many comments coming through. There's one thing that I can say is that you certainly triggered great discussion in the breakout rooms. I wouldn't even attempt to try and summarize all of what's there, but it's clear that a lot of people are agreeing that it's very easy to identify the misalignment. Now, some of that is as a result of it now being pointed out, but I think in many instances it's people were aware of it themselves. And the real questions that we now need to ask and answer are how we get to moving from that space to where we want to be and where students are more active in their learning, and how we engage well, I was going to say all three partners in the creation of that assessment, but actually some of the suggestions coming through are also that we need a fourth partner where there is a regulator involved as well. So looking at how we can expand it out from that. And I think probably we could have a whole new seminar just on that discussion alone. But I think I'm conscious of the time, and everyone else has done so well to keep to the time. I'll do my best now to follow suit. So I'll hand back over to you, Peter, and thank you very much, Rola.
Thank you.